The prevalence and cost of depression is rapidly grabbing attention. Studies show that at any one time, about 10% of the adult population has some symptoms of depression. With depressive disorders often as disabling as cancer or heart disease, it has become an ever-critical issue in providing care today. The burden is even greater for women, with female patients experiencing major depression about twice as often as men. Unique risk factors from reproductive hormones to social pressures to female responses to life stressors all account for gender differences in the prevalence of depression. True, there are many diseases and conditions competing for your attention, but despite advancements in the treatment and understanding of depression, many physicians continue to discount depression symptoms. As a result, less than a quarter of those suffering from depression receive adequate treatment. But clinical depression is a real illness that interferes with a person's capacity to function in the world. And while some physicians only focus on the physical illness, we now recognize the correlation between physical and mental health problems. Sometimes focusing on the physical alone can be counterproductive. The point is, you need to make the mind-body connection. While many primary care physicians are not armed to fully recognize, diagnose, and treat depression, referral is often not an option. Reports of catastrophic shortages of psychiatrists, with an estimated shortfall of around 45,000 psychiatrists in the U.S. today, and a wait list longer than 2 months to see a specialist can undermine efforts. Instead of trying to transfer patients to specialists who aren't available, it makes more sense to improve the quality of depression care provided at the primary care level. Even though it's one of the most common conditions seen in physician offices today, primary care fails to reach a significant number of people with depression. Delivering quality, effective depression care within the context of a patient's overall health and well-being is becoming an important, indeed indispensable part of care strategies. Physicians must also recognize that depression care is not a one-size-fits-all approach. It's a tricky proposition, but disparities exist in key subpopulations. Not only are women more prone to depression than men, physicians may need to consider special treatment options in female patients. To help close the gender gap, improving the knowledge of management options and decision-making abilities of healthcare providers can positively impact the early detection and appropriate management of depression in women. The problem is, traditional, lecture-based, or text-only CME tends to be short on useful information and long on snooze time. Most traditional instruction is unlikely to change behavior and practice patterns. We have to begin rethinking learning activities in ways that can improve learning, to reach and engage you in a way we never have before. Women in Depression, Navigating the Clinical Course is different. It was built on emerging perspectives of how adults effectively learn today. It brings together better user engagement in a highly interactive, branched learning format. This case-based, problem-centered game unfolds creatively, addressing a broad range of the most pressing issues in depression management. The activity is self-directed, allowing you to drill down and get technical while bringing in your own practice experience and knowledge. Fostering deep learning, the program has immediate relevance to your practice and allows you to apply the knowledge gained today. It's information that connects. Discover how the application of serious gaming can impact your patient outcomes. Begin play today at www.mddinwomen.com.